Hi, you're listening to the Mito Podcast. I'm Ashley.
And I'm Megan.
We know it's been a while since our last episode, but life happens, right? We're so glad to be back, and we have something really exciting to share with you.
Recently, we came across a company that's making a real impact in the mitochondrial disease community, Blue Oak Nutraceuticals. Their work caught our attention, and we knew we had to dig deeper and bring the conversation to you.
So, in this special three-part series, we sit down with Monica and Sonya from Blue Oak to talk about what they're doing, why it matters, and how their approach is offering hope to families like ours.
So each episode runs about 20 to 30 minutes, so you can listen all at once or just tune in whenever you have the time, whether you're on a walk, doing dishes, or driving to yet another appointment, we've got you covered.
We also want to let you know that we're not affiliated with Blue Oak, but because of the impact they have created, we wanted to get the information out so you can do your own research and see if this is something you want to try for you or for your family.
Hello, Blue Oak. Welcome to part one of our three-part series with the team at Blue Oak Nutraceuticals. In this episode, we get to know Monica and Sonya, the inspiring women behind Blue Oak. They share how the company got started, why mitochondrial health became their mission, and what drives them to push the science forward. If you're curious about the why behind their work, this is the perfect place to start.
So we wanted to have you guys here you guys have been really popular in San Diego right now. Let's just say that. We wanted to be able to have a podcast with you guys so that it gave you the opportunity to talk a little bit about yourselves and talk a little bit about what you have going on and why that's making such a big impact for everybody with mitochondrial diseases or mitochondrial dysfunctions. So why don't we go ahead and get started with, I don't know who would like to speak first, but introducing yourselves.
Sure. Sonya, you want to go first?
Sure, absolutely. So my name is Sonya Pelia, and Monica is the other person on this other side. I actually, like Monica, I'm a Silicon Valley startup person. And our passion really, and that's how Monica and I came to get together, which is also a different story, and I'll let her share some of it. But our passion really is startups and building startups. And sometimes they've been our own startups, sometimes we've been CMOs, CTOs in other people's startups. And I know for a fact that both of us have worked at large companies. In Monica's case, she was at Apple as an engineer, and I was at Cisco Systems as a technical writer in other bigger companies and did not like it at all. So we realized that both of us, when we met, we are mavericks, and we have a great meeting of the minds because we are problem solvers. And so Monica and I met right before the pandemic, and then the pandemic, of course, struck, right? And she had come out of her last startup. I also left my last startup while my CEO just kind of fell apart, and he laid everyone off except engineering. And we actually were a part of a women's leadership organization, very passionate about that. And we met again during the pandemic, and we decided that, compared to many women, we were in a fortunate place. There was a huge amount of layoffs happening. People didn't know whether they would have a job if they didn't have it was just terrible. That first year was just terrible. So Monica, actually, she will talk about her experiences. She does meditation. She's very calm, unlike me, who's always more excitable. And we decided we would do a resilience class for women. I think, when we're in our careers, we're so busy thinking about what's the next step, what's the next crisis, what's the next job. But how do we become resilient to face changes? And the world has really changed in the last 5 years. And so we did this workshop, and it was for me as much a learning as sharing. And I also do a meditation. I do mentoring of women in their careers. And I will stop there, and I will let Monica take on the story now, starting with the Monarch Mavens and her own background.
So yes, so thank you, Ashley and Megan, for having us here. And as Sonya said, the two of us have been in the Valley here. We've been doing a series of startup companies. And in the last one, I was actually CEO of a cyber intelligence company. Um, just before the pandemic, I'm also a breast cancer survivor. And so my cancer came back just as we got into the pandemic. And so to me, in some sense, a blessing in disguise because I was able to go through my treatment, my recovery, and so on. A little more calmly, if you will. But as Sonia said, we're both builders, we're makers, we're problem solvers, and we had so much fun doing this resilience class, working together and going through the workshop that we both share a passion for supporting women, whether they're moms or in their careers, founders, CEOs, and so on. And so we actually created a little consulting company called the Monarch Mavens. We're the transformation experts, and we spent the pandemic pretty much the last 2-3 years helping small startup companies as they with their business plans, with their strategies, with their messaging. We had so much fun, and several of them had really good exits. But we really loved that problem solving and building aspect of it, and supporting and coaching and mentoring people. And one of our companies that we came across actually was a dietary supplement company, and we're like, we're technology people, we're software people, we know nothing about dietary supplements. However, we know how to build revenue engines, we know how to build e-commerce sites, and so on. And so we asked our friends, does anybody know anyone who knows anything about biochemistry or dietary supplements and so on? And that's when we got introduced to Sandeep Dugar, who is our co-founder. Sandeep had spent an entire lifetime in the drug discovery field in pharma. He's got 2 drugs to his name that he invented that are, very billion-dollar drugs basically in the market. But when we met him, he had become a little frustrated that so much of the industry was so focused on profits and so focused on had a fiduciary responsibility to deliver for Wall Street, that he just had enough. And after we talked to him about this other company, a few weeks later, he called us back and said, "Hey, can we talk?" And we said, "Sure, have a cup of coffee." And that's when he started telling us about his frustration, about, how his vision was of, trying to support more families with solutions, if you will. And we started brainstorming, and he told us a little bit about all his research, all the work that he had done. And we met for almost 8-9 months. We met in a coffee shop for 3-4 hours, hearing about the vision, hearing about the industry, hearing about what he had. And we both started reading all the research papers. And as I was reading those papers, all of a sudden it was like the light bulb went off for me. So I am also a mother of a child with a rare disease, a mitochondrial disease, Friedreich's ataxia. And when I read that research, it was like, wait a minute, this could help my daughter. And so then I started paying more attention, if you will.
Mhm.
And basically, as I learned more, Sandeep came up and said, "Oh, by the way, I'm going to India. There's a parent association there that's invited me to speak about what I have." And we're like, "We're coming." So he was like, "What?" So I was actually heading to Portugal on vacation. So I changed my tickets, and, instead of coming back home, I went to Mumbai. And Sonia was heading to the Maldives to meet her daughter who was working there. Where was she? In the Indian Ocean somewhere?
No, she was on this French island in the middle of the Indian Ocean between Madagascar and Mauritius. And the study was the reason why we got so interested. So I don't know if you know the research. One of the key studies which we are able to use for this particular product is Becker's muscular dystrophy. And he was going to meet the Becker's muscular dystrophy community in Mumbai. And here's the thing, we're startup people. We meet we've met hundreds of startups. We pitch judge startups at accelerators and incubators. So we are very fine-tuned to the idea of, is the idea have legs or not? Okay. So when we are pitch judges, we have 3 minutes to decide, hey, is it a thumbs up or thumbs down? But the problem is we don't have backgrounds in chemistry. So we have no idea to judge, is this really, I know the science is there, but is this really an idea that people want? And what are the patient communities saying? I mean, Monica has some experience because of her daughter's condition, but that's not the same as launching a startup and doing something that's completely out of the left field, so to speak, right? The most of the nutraceuticals or dietary supplements have such sketchy reputations, rightly so. However, this is science-based, and we found, I think, 2 companies, Monica, that were doing science-based nutraceuticals. But the thing is, it was so out of our realm. I have to say, I had a constant headache the first few months because Sandeep would have 50 slides that he would go over. And we didn't even know the terms he was saying. We couldn't pronounce some of them. And here we are 2, really smart women.
We just got on a plane. We went there.
We went
met
there,
the community,
yeah.
and when we met the community, and we heard, I don't know what it was, but something happened, and we basically got back, and the 3 of us looked at each other, and we're like, if we don't do this, who will? And so we decided that, okay, let's do it. And, in order to not have issues, but we also knew that we were going to be mission driven, that our objective was going to do this such that we could make the biggest impact and make this accessible to the most people that we could. We knew that traditionally industry only focused on profits and only focused on North America and Europe. We wanted this to be out to anyone and everyone who needed it. And so we said, okay, well then let's do this ourselves. We bootstrapped, we put our own cash in. We have no paychecks, but we made the decision in August of 23. I have to say, okay, I'll just say it. In December of 23, my daughter was diagnosed with a heart condition. And so she was the first one. We were able to get lab samples, and we were able to have her start on Mitokatlyst. And Sonia's mom was the second person. She had come back from India with, again, having lost a lot of weight and so on. 1 year later, my daughter's heart condition is completely reversed, and she's doing really well. By the way, also, since I'm a cancer survivor, this was the 3rd time that the cancer had come back. I had breast cancer, and every time I was not able to stay on the estrogen blockers because of the severe joint pain that I had in my hands and my knees. This time I also started taking the samples, and all I can say is I'm able to tolerate. The pain is a fraction of what it was otherwise. And so, here we are. We launched the company in August of 24, and yeah, it's been a roller coaster since then. It's been heartbreaking to hear stories, but it's also been so satisfying, when we heard some good news as well. So let me stop right there.
I have so many things going through my head. I should have taken a lot more notes, but I was so intrigued with what you guys were saying. I stopped because I just wanted to be present and listen to you. That's amazing. I really appreciate you going back as far as like saying like your background isn't science, your background isn't medical, but I think anyone that is being diagnosed with a and I'm going to stick to mitochondrial diseases just because that's what we know best between Megan and myself. But when you get diagnosed, or when you hear that diagnosis for your child, so many people don't have those backgrounds, and you're kind of thrown into this lifestyle of long words and trying to remember every doctor and their backgrounds and just being overconsumed. So I can understand, like, even if you had similar jobs like cybersecurity or engineering, like your brain just works differently. This just throws you into something that a lot of people are not comfortable with, but you learn it quick. And it's definitely not a disease that you're never going to meet a person and not be affected by their story in some way. So we really appreciate that you guys did take that chance and go to India and listen to Sandeep and what he had going on there. And then it sounds like that experience or something happened during that time that kind of just sparked that flame that's like, no, we have to dive for it. We got to do it. And I didn't realize that the company was so young, that Mitokatlyst was so young. I knew it was to the point of the trials that I'm hearing about and things like that. But that's amazing how much you guys have affected in such a short amount of time. That is crazy. Megan, did you want to say anything before I just keep going?
Well, I was just going to say it was very interesting listening to your story. And I think you touched on so many things that, like Ashley and I have been in the mitochondrial disease world for quite some time now. And what you had mentioned about Sandeep speaking about how the big pharma and they're, really focused on making a profit. And unfortunately, as you know, in the rare disease world, there's not going to be profits to be made because it's a small community of children or adults with these diseases. And if there is, a pharmaceutical that goes through all the trials and makes it, it's not necessarily going to be profitable unless it's something that, basically is able to treat so many more diseases than just your tiny little rare disease. And so, hearing his frustrations with that, we appreciate as parents because we sit and we look at the trials and, are hopeful, but then we also know, and have spoken to so many doctors that unless it's really going to be something that's going to have a broader effect on the population, it's not generally something that's going to make it down the line. And then I thought the other interesting thing too was mitochondrial disease. Basically, all of our treatments that we are prescribed from doctors are all supplements. And supplements are a little bit of a scary world because they're not necessarily monitored. And it's so nice to hear that there is science backing this one, and there are studies that, of course, you have on your website. Because as a parent, we want that science. We want something telling us, these are the things that have worked or not. And I liked that those points that you were speaking of, because as a parent of a child my son has 2 rare diseases, there's a lot of things that we look for. We may not be scientists either, but as Ashley was saying, we're pretty close by the time you have spent a few years taking care of your child and advocating for them and doing all the research on your own. You start learning things you never thought you would ever have to learn.
But my last biology class was back in high school.
But I think you said something very interesting, Ashley, that something happened to us. And I've actually been an activist, a gender equality activist in the other half of my life for 32 years. I volunteer with the Domestic Violence Organization. I've been in their key leadership for 30 plus years, 32 years. My heart broke in Bombay when I could see the level of anxiety of the parents sitting there. And I think it was just for me, even though I've been exposed to suffering and, in domestic violence and gender inequality, I felt my heart cracked. And just to be confronted with parents and they may not say anything overtly, but the questions that they asked. And, Dr. Arun Vadachare, who's also on our scientific advisory board, he got on the call in the middle of the night. He's in St. Louis, Missouri, and he got on the call and he was talking. And I just could sense in that room the parents and their absolute desperation for something that provides not hope. I mean, how many times do we tell people, oh, something's going to come along and it's going to be fixed, but it isn't, right? But to find some kind of a relief. And so I think that was one thing. Of course, Monica has had the experience, but when we came back, and then we met, we came down to San Diego, we had an event up here in Palo Alto, and my heart broke all over again. It's when you start thinking about that, why is this not possible, right? We are a wealthy country. We have so much science. And by the way, the second point to your question, which was, I think the other something happened to us, this molecule was studied by Sandeep and all of the scientists involved, a huge number of them, for 16 years.
Yeah, I think that's what got us 64 papers, 15 clinical studies. It's like, wait a minute, something's wrong here.
Why is this not on the market?
And so I think one of the biggest troubles we had was, wait a minute, what are we missing? Why has this not happened? We're missing something. So we kept looking for what are we missing? And finally we came to the conclusion, like, maybe it's just, doesn't make business sense perhaps. But there's
it makes every human, it makes human
common sense. It makes common sense. I'm sorry.
And it makes ethical sense, and I think so, and that's why we self-funded this, right? And we decided, okay, how do we get fast to market? And this whole thing, we have the proof points. This molecule has been in the human diet for 5,000 years, right? I mean, what more proof points? And I think because we are startup people and we are problem solvers, for us, it's not insurmountable. What is the problem here? Why is this product not in the hands of people who need it and need to try it? And I think for us, it's bewildering because we are, the world in the Silicon Valley moves really fast. And every day you get up and you solve a new problem, right? You cross a new bridge, you fight enormous odds. And so I think for us, this thing that it has to be done like this or that. But Sandeep is also, I want to say, just amazed by his innovative mind. And we have a real melding of the mind, the three of us, the way we work together. But I think for us, we just couldn't understand, why is this not on the market? That's simple and that complicated. And so when we started looking and saying, okay, so there are 15 preclinical, we can't claim the preclinicals because we are a dietary supplement. Fine. Our lawyer, we have a nutraceutical lawyer, he said you can claim the human trials. Okay, great. And then we did not realize, I think we knew some of it, but we didn't realize to the extent how many KOLs, key opinion leaders in science, were waiting for this product to be on the market. I mean, the day we launched and we went live, we went at a secret launch because, by the way, we not having money because we had to do everything bootstrap. And immediately the requests started pouring in. We have 8 more clinicals that are either launched or in the process of launching. And we launched in August, as Monica mentioned. Every KOL who knows Sandeep or knows Dr. Bob Navio or knows any of the key people here, they are like, okay, we need to start a trial. So clearly there was the demand, there was the need. And so I guess we were the lucky people who got the opportunity to bring this to market.
We are the smart people, right? I mean, like you said, this has been around for 16 years, or at least the science of it. And you really just needed that brave person to step forward and say, no, I'm going to do it.
We don't know what we don't know. And, we have to just do what we can. And then, we just show up and whatever happens, we'll deal with it when the time comes. But our objective, our priority right now is, because, we don't have any marketing budget. Our priority now is just, okay, so, we just started telling all our friends and our families, and Sandeep started telling all the people he'd been working with the last, dozens of years. And so it's simply been word of mouth. And I want to thank, Christina and the Mito moms for helping us get the word out as well.
Yeah, it's been so gratifying for us to meet the kind of community that the Mito moms community is, and other KOLs. I think it's just been really gratifying that there is this desire, this understanding of the product and understanding of what we have produced. So one of the things, by the way, I just wanted to say as a side note, on a lighter note, I am the shipping department right now. And I'm also the support person. So sometimes when
I hate finance, but I'm doing accounting.
She's the finance person. So Monica's doing, and I have to say I hate finance. So she's taken it on, right? So she does all the accounting stuff. But the thing is, it's so gratifying to hear people say that they've been on this and they've had some change or benefit or whatever. some of the trials, that have launched, very, very gratifying. But I will say also this, that the learning curve was so steep that I used to have a constant headache from trying to understand the science. And I did actually have, I was pre-med, but the problem was it was decades ago, right? So I've forgotten everything. And so, Sandeep would educate us, and both of us would go and research stuff. We'd write it down. But I think startups and these kind of things are done by people who are like, okay, I don't know this, let me learn it. Not knowing what is in front of you. How difficult is this, right? When people talk, sometimes we Sandeep, after 3 minutes, we can't even follow what he's saying to us in some sense, and we have to research it, ask him to repeat it. But I guess we are fearless and fools, Monica. Maybe we are fearless fools, or I don't know. I don't know. Stepping in where we have no idea.
We don't know what we don't know, and but we're happy to learn.
Yes.
That's all there is to it.